If your child has epilepsy and your doctor has prescribed the medicine Diastat, please watch this video. It will describe and show you how to give the medicine to your child to stop a seizure. For more information, see our other handouts about Diastat and seizures, Seizures and Epilepsy, Seizure First Aid, how to give Diastat, a rectal medication to stop seizures. This video is brought to you by the Neurology Department at Seattle Children's. In this video, we will cover what is Diastat? How do I give Diastat? What things do I need if my child is having a seizure? When do I need to call my provider or 911? And how do I dispose of Diastat? Please be aware that this video contains drawings of a child's buttocks or butt. Diastat is diazepam rectal gel. The rectum is just inside the anus, the hole where poop or feces comes out. This medicine will go in the rectum, not the mouth or the nose. Each packet or kit you get from the pharmacy will contain 2 doses. Each syringe contains 1 dose. The pharmacist will set the correct dose according to your provider's prescription. Only give Diastat to a child who is having a seizure. Give Diastat to your child if their seizure has lasted more than 4 minutes or as prescribed by your provider. Before you give Diastat to your child, get these supplies ready: Diastat syringe, lubricating jelly, watch, stopwatch, or timer on a cell phone. You can do this ahead of a seizure so everything is in the same place and you don't have to hunt for items while the seizure is happening. Do not remove the cap until 3 minutes and 30 seconds into the seizure. Many seizures will stop before 4 minutes and you will not need the medicine. If you remove the cap and don't use it, you have to throw it away. Open the Diastat package. There should be 2 doses in a single package. Push the cap up with your thumb to remove it. Be sure the seal pin is removed with the cap. The seal pin is inside the cap. Dip the syringe into the packet of lubricating jelly. If your child is in a safe location where they won't fall or hit something that could fall on them, leave your child where they are having their seizure. If not, gently move them to a safe place. Then turn them on their side, facing you. Pull down your child's pants and underwear. Bend the upper leg forward. Separate the buttocks to expose the anus. Gently insert the plastic syringe tip into the rectum. Make sure the rim of the syringe is snug against the anus. Slowly count to 3 as you push the plunger until it stops. Slowly count to 3 before removing the syringe. Then slowly count to 3 again while holding the buttocks together to prevent leakage. Keep your child on their side facing you. Continue to observe them and have your phone ready to call 911 if you notice problems. Note the time, dose given, and how long the seizure lasts. If this is the first time you give Diastat to your child, call 911 during the seizure. After your child is safe, call your provider. After any seizure, you should call your provider or send a message using MyChart. Don't try to call our office during your child's seizure, as we might not be able to respond at that moment. Call 911 if you need emergency help. Call 911 during the seizure if any of the following happen. The seizure continues 5 minutes after you gave Diastat. The seizure behavior is different from other episodes. You are alarmed by this seizure being more severe than usual. Your child is having more seizures than usual. The color or breathing of your child do not seem normal, or any other unusual or serious problems. To dispose of the medicine, throw it in the garbage. Keep it away from other children and pets. Do not reuse any leftover Diastat. Use a new syringe every time. To summarize, use Diastat rectal gel to stop your child's seizure if it lasts more than 4 minutes or as directed by your provider. Use the lubricating jelly before inserting the syringe. Push all the medicine in for 3 seconds. Hold the syringe in place for 3 seconds. Remove the syringe and push the buttocks together for 3 more seconds. Take note of the time you gave it, how much, and how long the seizure lasted. Call 911 if it's the first time you have given your child Diastat, or if you notice unusual symptoms. Call your provider after the seizure is over if it's your first time giving Diastat. Throw it away in a safe place. If you have any questions, please call the neurology clinic at 206-987-2078, option 4, between the hours of 8 a.m. and 4:30 p.m. Evenings, weekends, and holidays, call the hospital general number at 206-987-2000 and ask for the neurology provider on call. Thank you for entrusting your child's care to Seattle Children's Hospital.